And I think we're now ready to begin the speaker interventions. And I would like to invite to make the first speaker intervention, Catherine Cox, who's also speaking on behalf of Janet Williams. Please come and give us your presentation.
Good afternoon. Thank you for commissioning this review, acknowledging the serious impact Valproate can have on children of mothers prescribed it. When in fact started our campaign in 2013, there was little information given directly to female patients by medical professionals, and we found that no booklets were available to be given out by the Department of Health or the NHS on epilepsy medication in pregnancy. The advice and the information which was offered was sparse and inconsistent, and the majority of GPs and specialists were unaware or opted not to give vital information. Our research from earlier this month shows that 70% of women are still not informed of the risk of fetal valproate syndrome in their children, with most seeking advice from us when they find out after the fact. This is not acceptable. This pattern reflects a history of regulation of the drug and was due to instructions given out by the Committee for Safety in Medicines when Valproate was first licensed in 1973. Data sheets explaining the teratogenic effect were sent to doctors, but they were told that this was to be without the patients themselves seeing it. In fact, holds a copy of the committee's minutes which state this. In fact, are aware and have government documentation citing that Sanofi behaved in line with scientific knowledge, alerting the Committee for Safety of Medicines of the risk, stating that care should be taken in prescribing anticonvulsant compounds, including Epilim, to epileptic women who may become pregnant. Remarkably, it's taken 44 years for these warnings to be given freely, showing that this is a licensing issue and these warnings should have and could have been given in 1974, just as the warning for myceline in pregnancy, another anti-epileptic drug, was given by ICI previously. However, there was a deliberate decision not to publish the warnings rather than to include them as recommended by the drug company. We also hold documentation of a Dear Doctor letter sent out in 1973, just after Valproate was licensed, which stated, "It would be best if the prescribers were all made aware of the nature of the evidence and recommended that a statement similar to that proposed by ICI could be included in all relevant data sheets, but not on the packaging inserts, so there would be no danger of the patients themselves seeing it." We are aware that the Valproate toolkit, as it stands, should have been possible back in 1974, following recommendations made on the product licence. In March 1974, the main committee stated that Valproate was for use in generalised focal or other epilepsy. In women of childbearing age, it should only be used in severe cases or those resistant to other treatments, also confirming that they understood that the drug was teratogenic. Official figures for those harmed by Valproate in pregnancy may never be known precisely. However, through research papers such as the MAN study in 2012 and figures given by the MHRA at INFACT's last meeting with them and the Minister, we know that around 400 children were affected by the drug from February 2016 to present, while we have had to wait for the new toolkit to be used routinely by all healthcare professionals. INFACT's figures have been calculated from the Office of National Statistics for England and Wales, using the figures from the MAN study. Our figures are calculated by the number of live births each year and the figures taken from the MAN study, which states that the lowest prescription rate of Valproate in 2009 was 0.1%. While the prescribing of Valproate to women of childbearing age may be decreasing for some medical conditions, for example epilepsy, the panel will be aware that there are off-licence uses for conditions such as migraine and as a mood stabiliser in ADHD, which allows a wider demographic of women to be put at risk. Due to the Bromley study of 2013, we also know that around 40% of those exposed to the drugs will be affected by major malformation or autistic spectrum disorders. Calculations show that between 2012 and 2015, the total Valproate victim rate stood at around 2,800, with there being no change during 2016. Consequently, we truly believe that the current figure for possible Valproate victims is higher than that quoted by the MHRA. Over the past 15 years, the question of Valproate victims giving birth to children who also carry the syndrome has also been very much in the mind of parents, We now know through a research paper published in 2016 that this is the case, and investigative findings have confirmed this. Children affected by valproate in utero, robbed of their deserved past and present, are now facing a real risk of being robbed of their future. This is why I in fact believe that valproate requires strict controls in women during their childbearing years, and this has contributed to the current rise in autism rates. Although we appreciate the new warnings and the increase of doctors voluntarily using them, more effort is needed to ensure fewer children become victims. FACSA supports approximately 1,000 families with approximately 2,750 children affected by valproate in utero on our books. This includes families who have grandchildren with a transgenerational link. Almost all the women prescribed valproate in pregnancy were unaware of the risks to their unborn child. A great many women asked questions prior to pregnancy, but assured that there was a very small risk of malformation, which could be detected at a 20-week scan, for example, cleft palate. None of the mothers expected that their children would be born with the condition they have, which is debilitating and impacts on their lives every single day. We are happy to supply a list of known symptoms which the MRHA or doctors may not connect to the syndrome. The past mistakes of the government need addressing. Our children need a care plan and a supportive pathway into the future, treated with respect and compassion. I would also ask you to consider who will care about valproate children when their parents are no longer here, because currently it is clear that no one but their loved ones show any inclination to support them. There is nothing to lose and everything to gain by making reporting of risks mandatory to girls and women prescribed valproate. If you do not give women a choice, you deprive them of a voice to protect their child. The women who speak to you today, who have personal experience, have been deprived of a choice, of that voice, to protect their children. And it's important the EMA gives that fundamental right back to women across the UK for the future. It is also the moral choice that the MHRA should have already taken. Thank you.
Well, thank you very much indeed, Mrs. Cox, for a very clear presentation, for describing so powerfully the effects, the nature, and for putting a very, very strong case for clear communication to those women who are using valproate. So we do have a minute or two for any questions, for clarification, for anyone to ask any more that you would like to know about from the PRAC.
Now